So our next speaker takes us into the world of medicine, and I think we'll have some predictions up his sleeve. Dr. Gerald Dubowitz is our next speaker, and it's a privilege to welcome him to the stage. He left the UK in 1997. How could you, Gerald? And he arrived in the Bay Area 2.5 years later by way of Nepal and New Zealand, the South Pacific, and a few places in between. Honestly, some airlines, isn't it? I mean, they're the giddy limit. It's very, very good to see you back here today, Gerald. Gerald Dubowitz is an anaesthetist, but I can assure you he's not going to be sending anyone to sleep this afternoon, and he's very welcome to the Silicon Valley Comes to the UK stage. Gerald, thank you very much.
Ah, there we go. Let's talk about health. Let's talk about your health. So some of you here today, or someone you know, maybe someone you love, will probably have had surgery at some point in their lives. Maybe an appendix operation, maybe they've had childbirth, they've had a cesarean section, maybe they've had some treatment for a road traffic accident, a broken limb, or maybe even surgical treatment for cancer. Now, to make sure these people don't feel pain, and to make sure that they get appropriate treatment, and to make sure that they survive the surgery, they need someone like me. See, I'm an anaesthetist, and as I've been introduced to, I put people to sleep. But my remit today is not to do that. So when we look at our country here, and we realize with our population that 5,000 like you need one like me. Okay, so we've got 10,000 anaesthetists in the UK. But if you go to somewhere else, say Africa, Tanzania, similar populations should have the same number, but they only have 10. So my area of innovation is training. It's training people to fill this gap. And the reason is because everyone in the world globally should be able to have access to surgery and safe surgery. So to do this in Tanzania, we have to go from 10 to 10,000. Now we've got 10x thinking, haven't we? We've got 100x thinking. And I'm the person that decided to take on the project that is 1,000x. So having started in North London, I actually live in San Francisco now, which some of you know is that little village just north of Silicon Valley. And just across this bridge, I work and live in one of the most technologically advanced environments. You know, I'm surrounded by some of the most advanced and incredible technological innovations in the world. We've got leaders in biotech, genomics, we've got health research, we've got development places like Silicon Valley, also the Stanfords, the UCSF, and the Berkeleys of this world. It's a fantastic place to live and work. But I'm here today because somewhere along the line I came a little bit frustrated about the fact that when you cross this bridge, there are people that don't have access to this stuff, and I really wanted to do something about it. Now, we work in an incredible technologically advanced environment. But the thing is, if you go to somewhere where you cross the bridge and you go to somewhere like Africa, they have nothing like this at all. There aren't even enough doctors in Africa to use old technology, let alone the new stuff that's coming out. Now, we work with many partners. And those partners work with us because we're all dedicated to one thing, which is advancing healthcare over the next 10 years. But if you want to impact this, if you want to really get to the people on the ground actually need to take possession of these problems, and we need to find solutions to these problems one by one. You see, an incredible idea can sometimes just disrupt the cost base of treatment, and then it doesn't work because it no longer fits that system. And a solution may fit a technological problem, but then it fails because of human failure. And it fails because because you're not asking the people on the ground. And if you don't ask people on the ground, you've almost guaranteed to fail. Entrepreneurship in low-income country is training. Innovation is not just the technology, but it's bringing the technology to the people, and training is an incredible part of that. Now, what's sort of intriguing to me a little bit is that when you work in an area like this, and you think about the valley, you think about Silicon Valley or the technological capitals of the world, it's incredible what the barriers are to healthcare innovation. We're told it takes 17 years to get health tech all the way down to the end user and to be used as if it's been there all the time. And the problem is crossing this chasm, coming across the bridge to get people to actually adopt it. And there's some incredible barriers to teaching and education, and sometimes even both. But what's intriguing when you go across to a lower income country, you go to somewhere else, there seems to be able to create massive impact out there. And that massive impact comes because they've got fewer resources. Well, maybe it comes because actually you've got the least friction to introducing new technology. And out there, you find that you've got the most motivation for change. So it's a paradox because in places like Africa, we have a massive impact and have it much more quickly in spite of having those few resources. And we found by our heroic failures that in fact, technology alone is not the best answer. Now, don't worry, I'm not smoking medical marijuana here. Technology and technological innovation are the way forward. There's no question about that. But at the same time, they can disrupt a system that is already unstable. And this happens because if you think about the technology and not about the implementation of that technology, and that is where teaching and training come in, then you might actually end up with a failure. So we've looked at ways to leverage existing technologies to help instead. I mean, take an existing platform like social media. Okay? So we're in Africa now. A few months ago, there was a 24-year-old mother who arrived in the emergency room at Moshi Hospital in northern Tanzania at 2 o'clock in the morning. Now, one of our trainees out there, Dr. Anspert, saw her, and he realized there was a small problem here. She had a massive head injury because in Tanzania, there aren't a lot of helmets on the motorcycles. But at the same time, she was 32 weeks pregnant. Now, the thing with that is that if you try to treat it in my environment, in an incredible technological environment with everything that we have, it's a massively complex problem. Head injury, pregnant mother, having to save both of them at the same time is more than people could do with. So what Dr. Anspert did, actually, because part of our program is actually an education system. And so what we have there is he was able to get onto WhatsApp and send me a message. Now, I'm the lucky one because you see 2 o'clock in the morning in Tanzania is 4 o'clock in the afternoon in California, which is quite convenient. And I was able to go through with him this patient in this environment and explain to him how he could safely give an anesthetic to this person using the existing platform. Now, just bear in mind, I'm not trying to promote one particular technology here. I'm promoting a concept. Because I think what it is that when resources are low and things are limited, but the stakes are very high, we have to use what's already there and leverage it to our advantage, and then build on those implementations and advances to create new technologies. You can disrupt existing technologies and ideas and use them to your advantage, but be very, very wary of creating something that you want that they don't need and they can't use. So why do we use WhatsApp here? Well, WhatsApp is already on their phones. It's free. It doesn't actually involve anything that we have to download there, and there's no instruction manual needed at all. In fact, we didn't have to show them how to use it. They virtually showed us how to use it. It's a teenager thing. This type of innovation is incredibly important in this environment because in Africa today, they have a death rate that is closer to the UK or the USA 100 years ago. Now, that's before DNA, before antibiotics, and even before Twitter. There are many other examples of this sort of adaptive approach. My colleagues in Nepal actually use a tablet-based platform to put education material on for teaching anesthetic nurses in the most rural parts of Nepal. Now, they put lectures on, they put lecture material on, they upload it all, and they give it to the nurses to train on. They didn't invent the tablets, they didn't even invent an app to go with it, but what they did is they provided something for people that wanted it in a way that they could use it. Consider that, on the other hand, technology that's specifically created. We hear about these fantastic innovations, like a low-cost device for monitoring patients, or we hear about an ultrasound machine that goes onto your iPhone that you can actually examine a baby with. These are incredible technologies, but why don't we have them here in the high technology environment? We really thought about bringing some of this technology back in the other direction and using it for our own uses as well. Now, it's vital that when we look at health tech to improve a health system we're working with, especially in a low income and a low resource setting, that we look at their market and figure out exactly what works. See, we can propose things, but really, the people aren't using them. We have to cut our losses and move on. Now, early reckoning of failure is something that all of you know a lot about. But it's different in my world. We're not very good at that. So in our quest for innovation over the next few years, you have to think about if you're bringing something to this sort of global market, that you really have to have local buy-in. You have to have someone on the ground that is going to tell you exactly what they need and give you a sort of local champion that's going to help you with that. Because the technological needs need to adapt to the people, because you shouldn't really expect the people to adapt to the technology. Education and training is the cornerstone of introducing tech globally, because that is what most often is missing. So, if we come back now across this bridge into the Silicon Valleys, into the tech capitals of this world, and learn from implementation and impact in a low-resource setting, and we want to bring it back to our own setting to enable advantages in technology for everybody, how are we going to be able to do that? So that we can have healthcare available to everybody, everywhere.